Page number 276, Growth and Development including Newborn Care. Topic: Chromosome disorders. Autosomal chromosomal disorders. Number 1 is Down syndrome or trisomy 21 or Mongolism. Down syndrome, trisomy 21 or Mongolism. Commonest chromosomal disorder. Women at high risk of giving birth to a child with a Down syndrome are those over the age of 34 years. Means Down syndrome is the most common chromosomal disorder. Means the chromosomal disorders that occur in child, the Down syndrome is the most common one among them. And women which are over the age of 34 years and they get conceived, then they have the highest risk of giving birth to a child with a Down syndrome. Type of Down syndrome. So there are a total 3 types of Down syndrome. There is trisomy 21, which affects 95% of all cases. So 3x chromosomes are chromosomes number 21. 3x chromosomes at chromosome number 21. So there is the chromosome number 21, which is the autosome, and at that 21 number chromosome there are supposed to be 2 chromosomes. Wait a minute. 2x chromosomes at number 21. How many pairs are there? So total number of chromosomes are 46. 46 is the total number of chromosomes, with 44 of them being autosomes and 2 of them are allosomes. 44 are autosomes. So if we divide 46 by 2, we get 23. So there are 23 pairs of chromosomes. 23 pairs of chromosomes, and from which there is the 21st pair. The 21st pair, which is supposed to have 2 chromosomes, it has 3 of them. It is supposed to have 2 chromosomes, but it has 3 of them, so that is why it is called as trisomy 21. So that is why it is called as trisomy 21, which is the first type of Down syndrome, trisomy 21, in which there are 3 chromosomes present at the 21st chromosomal pair. So total number of chromosomes become 47 instead of 46. So as we talked before, the total number of chromosomes become 46 instead of it becomes 47 instead of 46. So the total number of chromosomes is supposed to be 46, but in trisomy 21 it becomes 47. In trisomy 21 it becomes 47. So next to a type of Down syndrome is translocation of 21 with 14. So translocation means changing places. Means the 21 will take the place of 14 and 14 will take the place of 21. So translocation of 21 with 14, 4% of all cases are like this. So 95% are trisomy, 4% are 21, a translocation of 21 with 14, and 1% of them are mosaicism. Okay. Mosaicism are 1% of all cases. So there are 95% of Down syndrome, 4% of translocation of 21 with 14, and mosaicism is 1% of all cases, which means 95% plus 4% plus 1%. It makes a total of 100%. So 100% Down syndrome can be divided into 3 categories. 100% of Down syndrome can be divided into 3 categories. There are 3 types of Down syndrome. So first one has 95% of all cases, that is the trisomy 21. Second one is translocation of 21 with 14, which is like 4% of the cases of Down syndrome, and then 1% of the Down syndrome is mosaicism. So in mosaicism, what happens actually is, in a translocation of 21 with 14, what happens is total chromosomes are 46. So it is the chromosome number is normal, total number of chromosomes are 46, and the normal number is also 46, but one is large and atypical. But one of them is large and atypical. I think it doesn't have anything to do with this, but maybe it has. It is not detailedly in detail written over here, but there are 46 chromosomes, so the chromosome number is normal in translocation of 21 with 14, but one of them is large and atypical. That is the only chromosomal that is the only disorder there. Mosaicism is 1% of all cases, and here presence of cells of two different genetic materials. Presence of cells of two different genetic materials means there are cells which have a different genetic material. They are supposed to have just one genetic material, but they are having different genetic material. The same cell is having different genetic material in the same individual. So same individual is having different genetic material in their cells. So that occurs due to post-conceptional error in chromosomal division during mitosis. That occurs due to a post-conceptional error. So means after conception there is an error in chromosomal division, which during the mitosis. After conception there is a chromosomal division during mitosis. Okay, so clinical manifestation, what the child will look like in clinical manifestation. Clinical manifestation, very very important. Child look like Mongolian race, that is Chinese, Tibetans and Japanese. Small head, microcephaly with flat occiput. Small head, microcephaly. The head is supposed to be small, so this much head is small now. I think this is the normal size of the head, but they are supposed to say that this head is small because of microcephaly. We don't know the meaning of occiput here. Small teeth and protruding tongue. Okay, teeth are not shown, but there is a protruding tongue and small teeth. Okay, so there is small head, there is small teeth. So we know now two characteristics, small head and small teeth. Second one is sloping forehead along low set ears with small canals. Sloping forehead, low set ear canals. Sloping forehead, and these are supposed to be low set ear canals. Okay, mild to moderate mental retardation. So there is mild to moderate mental retardation also. So there is small head, small forehead. Wait a minute, small head and small. What is supposed to be small next? Small head, and there was the teeth ones. Okay, so this is small head, so small teeth and protruding tongue. There is mild to moderate mental retardation, and there is low set ears. Okay, so this forehead, then the teeth and tongue, then we again go slightly upside, that is the low set ears, and then we go up, then that is mental retardation. So 1 2 3 4, 1 2 3 4, 1 2 3 4, 1 2 3 4. Okay. Flat face and nasal bridge and oblique palpebral eyelid fissure. So we don't know what fissure means here. Eyelid fissure. Eyelid is supposed to be this area. So eyelid has a fissure. Eyelid fissure means it has a connecting point, I suppose. Flat face and nasal bridge. Flat face and nasal bridge and an eyelid fissure. That is the next characteristics. That is the flat face. Nasal bridge is also flat flat face and flat nasal bridge. And there is oblique parabral eyelid fissure. Oblique parabral palpebral, oblique palpebral oblique palpebral eyelid fissure. There is short and broad hand with single transverse palmar creases. Short and broad hand. So the hand is short and it is broad. So it is broad and the hand is short and broad hand with palmic creases, that is the simian creases. Okay, simian creases, short and broad hand with simian creases. Larger gap between first big toe and second toes of feet called sandal gap. There is large gap between first toe, this is the first toe and this is the second toe, so the sandal gap is large. First big toe and the second toe sandal gap is large. So let us see. Okay, this short forehead, short teeth and protruding tongue, low set of ears, mental retardation mild to moderate, flat face and nasal bridge. Then there is palpebral eyelid fissure, oblique palpebral eyelid fissure. Then there is short hands. Okay, so after the eyelid fissure we go to eyes to hand. That is, hand are short and broad with simian crease. Then toes, big toe and small toe, the gap is big, that is sandal gap. After that it is brachydactylic, abnormal shortness of the fingers and toes. Abnormal shortness of the finger and toes. Clinicodactyly, hypoplasia of middle phalanx of one and more finger resulting in inward curving of the finger. Clinodactylic hypoplasia of middle phalanx of one or more fingers resulting in the inward curving of these fingers.